Hi everyone, I'm Ian Harvey, massage therapist. This is my friend Ashley.
Hi.
Today we're going to be talking about working with mature scar tissue. So this isn't a recent injury, this is something that happened a long time ago, and how do we work with it? Today we're going to be working with Ashley's leg. Ashley, you got hurt by a piece of falling glass.
Shark bite.
Shark bite. She got hurt by a shark, and let's have a look at that leg. So we're down here on the distal tibia, and on the lateral aspect and a little bit toward the tibia itself, we've got a plane of skin that is adhered to the tissue underneath. It's not really going anywhere. And running under and around it, we've got plenty of tendons that we need to worry about. But we'll get to that more later. So Ashley, how long ago did you sustain the initial injury?
5 years ago in June.
5 years ago? Okay. And do you mind me telling your life story on YouTube?
No.
Okay, so you've had several surgeries since then, one of which there was some tissue rejection. You've had some issues with infection. So this has been through a lot other than just that initial trauma.
Right, yeah, there's a total of 10 surgeries, including 2 skin grafts.
10 surgeries, dear goodness. Okay, so this is past the remodeling phase. If you remember from massage school, when you sustain an injury, there is the initial stage of inflammation and laying down a ton of collagen, and then there's a remodeling phase that lasts from weeks to a few months, where the fibroblasts lay down and take up extra collagen, which we call scar tissue in this context, and hopefully make it more useful, make it so that it can function. But with repeated trauma, or if that function was never restored, this tissue can become contracted, it can become tight, and it doesn't have the function that we necessarily need. I want to start by warming the area up, and as I do, I'd like to talk a little bit about what this scar is currently like. So we're past that remodeling stage, and now there's not a lot of inflammation, there's not a lot of blood supply, so we can't make huge changes without those guys. A popular idea among massage therapists is that we break up scar tissue, but this type of collagen, this type of connective tissue, is stronger by many times than steel, and it's much stronger than the surrounding tissues. So if we're going to break anything down with our hands, it would be the other tissue that's not this collagenous scar tissue. So my concern as a massage therapist isn't how can I break this up, it's how can I support this entire leg, how can I support Ashley with her unique needs and challenges when it comes to her changed structure here. They had to reconfigure some things. And how can I make this entire area just feel subjectively better? I may not change the appearance too much, but hopefully over time we can make this scar a little less of a bother. And for anyone who's had a significant trauma or 10 plus significant traumas to the same area, how can we help them reintegrate this part of their body into the rest of them? I don't want my clients thinking of a leg as their bad leg. So I'm not going to be doing anything specifically for scar tissue release. I hear that term get bandied about a lot, but there is no releasing this scar. It's well adhered to the tissue underneath and to the superficial and deep fascia. So it's not going anywhere. What we can affect is the surrounding tissue. And this tibialis anterior and its friends up here have to pass through this region. Some important nervous tissue has to pass through that region. And the more we can get the nervous system locally to chill out, the fewer symptoms will come with this existing scar tissue. It's here to stay, but pain and spasm don't need to be here. I'm going to work with the entire area. I want to make sure that it's nicely warmed up and that I don't just focus solely on the visible bits or even on the deep scar tissue. I want to work with this entire leg and with the entire person. If I were to focus too much and never reintegrate, I could send my client away with the wrong idea about their own body. I could accidentally, kind of symbolically, cut my client up into bits. And that's not what I want. I want them leaving feeling more integrated than when they walked in. That's something else that I don't want, is to avoid this area. Something that I see somewhat often and that I hear reported from my clients is that they'll have this surgical scar or a scar from a past trauma, and massage therapists will avoid it. They'll kind of treat it like sacred ground that they're not allowed to touch. And that's also sending a message to the client that this is off limits and that this isn't something that needs touch or that deserves touch. And that's definitely not the message that I want to send. But I do want to keep in mind that these areas can be laden with a lot of very emotional memories. So have a conversation with your client if they have any sort of scar tissue, especially massive scarring or repeated surgeries. Ask them if you can make contact with that area. If they seem trepidatious, then have a conversation with them. Ask if any contact is okay, and if not, then maybe you can have that conversation again in the future. If they seem okay with it, then as you're working with their scar, ask them how they're doing, stay in touch. Let them know that at any time you're willing to move on. And some clients will come in specifically for scar work. And for them, I want to have a conversation about what I'm able to achieve. And that's that over time, we may be able to change some of the function, some of the pain, but that I don't expect a big change in appearance. So when working directly with scar tissue, remember about that deep friction from massage school. We can work in a circular fashion. This is a stimulus that the scar won't get from day-to-day use. We want to work with the tissue in ways that it's used to and in ways that are a little unfamiliar. We want to give it some new stimuli. One, to give the nervous system some more ideas about what this area is capable of, and to let it know that it doesn't need that pain or that spasm. And it's feasible that we can make changes in this over the course of years if we just spend some extra time with it in every session. Now, with any area that has received alteration surgically, there might be some changes to range of motion and to the local anatomy. For instance, Ashley has had a tendon redirected to the top of her foot to prevent plantar flexion. So, what I'm not going to do during this session is try to press her foot downward. That's not where it wants to go, and that's not something that I want to promote. I don't think that I can undo what the surgeon did, but I do think that it would be wise not to try. Having had some conversations with Ashley, one area that she does have trouble with is dorsiflexion. So as I'm working, I can promote movement in that direction to let the muscles know that they're capable of this movement. Start subtly, and checking in with the client over time, over the course of several sessions. Work with range of motion more and more and see what you're able to achieve. And again, don't get hyper-focused. Remember about all of these muscles that are involved. And whenever I'm working with a specific area of interest, I like to bounce back and forth between those broader moves and more specific ones. Staying in good contact with your client to make sure that you're not overworking the area, and checking in with them between sessions. So you can ask them next time you see them, after that last session, did you have any pain in that area? If so, you may have done a bit too much. Back off a bit, recalibrate, and move forward from there. And something else that I like to do when I'm working with mature scar tissue is to use active engagement. So I want the client to be using their muscles to assist in motions that have become difficult. I want their brain to get the idea that they're capable of these movements, and over time, over the course of many sessions, as I work with this scar tissue, as they engage, they're going to be able to move more and more, and that's something that I've seen with Ashley. So Ashley, go ahead and bring your foot up and down like this. Just gently rock it. And as she does that, I'm going to do some slow stripping using my client's pressure tolerance as a guide. So check in, make sure that they're able to enjoy this. This shouldn't be painful. If it is, you're sending the wrong message to the nervous system that there is danger. And Ashley, now I'd like you to wag your foot left and right. Good. And you can use plenty of different tools here. When you're working with scars, you don't have to use these fine specific tools. You can still do the broad ironing out. I don't think that I'm going to be accomplishing a lot more by sinking in super specifically. Again, we're having a conversation with the nervous system, and if we happen to increased fibroclast and fibroblast activity while we're doing it, that's just gravy. So I would include the rest of this low leg, I would include this entire limb and the entire body. I want this to be an integrative experience, even while occasionally I focus in. And I want to do passive and active movements to recruit the nervous system in different ways and to give it some different ideas about what this area is capable of. Alright guys, let me know what you think in the comments. Let me know if you have any tips or tricks for working with scar tissue yourself. Have you ever seen any marked visible improvements? I'd like to hear about it. If you enjoyed this, consider subscribing, and I will see you next time.